Control of the heartbeat is done in a few ways. There's internal control. Cardiac muscle, also known as myogenic muscle in the heart, differs from other muscles in the body because it contracts without external stimulation. The contractions are due to electrical impulses from two nodes located in the heart. The SA node, or sinoatrial node, stimulates the atria and stimulates the AV node, or atrioventricular node, which then sends an impulse through the Purkinje fibers to the ventricles. The SA node is a bundle of nerves and muscles, also known as the pacemaker of the heart. It sets the tempo of the heart about 70 beats per minute and 70 milliliters of blood at each beat. It's located in the top of the right atrium. It starts contraction of the atria, pushing blood into the ventricles. Nerve impulse travels from the SA node to other muscle cells by modified muscle tissues. The AV node picks up the impulse from the SA node and causes contraction of the ventricles. It sends blood out to the lungs and body. It passes nerve impulses along special fibers called Purkinje fibers along the septum and muscle tissue. An artificial pacemaker is used to emit electrical impulses when the SA node is not functioning properly. Arrhythmia is an irregular heartbeat. So the pacemaker is put under the skin and leads are attached in the area of the heart where the SA node is. Nervous stimulation. There are two regulatory nerves of the autonomic nervous system that help to control the heart rate: sympathetic nerves and parasympathetic nerves. These respond to the needs of the body by conducting impulses from the medulla oblongata and in the brain stem to the pacemaker of the heart, the SA node. The sympathetic nervous system is stimulated in times of stress. It's the fight or flight system. It increases heart rate, so blood flow to tissues increase. The parasympathetic nervous system is for relaxation. It slows heart rate. Increase in carbon dioxide in the blood due to exercise stimulates the medulla oblongata of the brain. The medulla sends a nerve impulse to the SA node to increase the heart rate. The increased heart rate circulates the blood to the lungs, removing excess carbon dioxide. High temperatures increase heart rate, and release of hormones such as adrenaline also increase heart rate. Disorders of the circulatory system. Atherosclerosis is a buildup of fatty material inside the arteries. The arteries become hard. It causes high blood pressure, also called hypertension. Arteries can rupture or blood clots can form. Angina is chest pain due to poor blood circulation to the heart. There's not enough oxygen to the heart. The heart is still getting some blood, but not enough, so it causes pain. Heart attack or cardiac arrest is caused by a blockage of the coronary arteries, the arteries that carry blood to the heart. This reduces blood flow to the heart. No oxygen means the heart dies. Heart attacks can be caused by high cholesterol and smoking. The early warning signs of a heart attack for males includes pressure in the center of the chest, pain in shoulders, neck, or arms, and chest discomfort with fainting, sweating, or nausea. In females, the symptoms can be quite different. There could be shortness of breath, abdominal pain, pale or clammy skin, unusual fatigue, which means tired, inability to sleep, nausea or vomiting, heart flutters, and then similar to males, shoulder, neck, jaw, arm, or back pain, dizziness or lightheadedness, and cold sweat. A stroke occurs when a blood clot lodges in a blood vessel in the brain, or if a blood vessel ruptures in the brain. Tissue damage becomes significant after about 4 minutes. It can result in death or mental or physical problems. Symptoms include weakness on one side of the body, trouble speaking, or paralysis on one side. It includes unequal pupils, facial problems, so facial muscle weakness, swallowing problems, or drooling. Embolus is a blood clot that dislodges and later jams in another blood vessel, causing a blockage. Aneurysms are due to a weak spot in an artery. If left undiscovered, it can be extremely dangerous. Rupture may cause instant death.